I'm going to leave most of the talking to Dr. Gales. This is just incredibly important that we understand the situation we're in. This is changing every day. There is no way you can make a plan now for 2 weeks from now or a month from now. All you can do is adjust to this as it unfolds. I would expect that you'll be seeing more actions to come over the next day or so. We're going to be in contact with the county executives around the region to talk about additional efforts that we can coordinate among jurisdictions. I just want people to know that, that we are doing everything we possibly can. The good news is that we actually started preparing for this back in January. So we're not running this on the fly, but we actually started out with an understanding of what was likely going to happen, and we started making plans for those circumstances. We have done as much as I think it is possible to do. The big issue out there in the community that I keep hearing about is testing and the lack of kits, and we dearly need the federal government to get serious about the provision of testing. No one should be confused that an apparent low number of cases is actually a low number of cases. It's simply our inability to test for the cases, and we need to get that information if we're going to keep our communities safe. So that's just vitally important to us. I want to say something to the kids out there who might be listening or might actually look at this. These are not snow days. This is not time off that people are getting so they can have a vacation. This isn't spring break. This is really serious. And even though you've heard that younger people don't necessarily get as sick, you have to understand that younger people, because they're not as sick, may not be identified as carrying the virus and could easily be carriers of the virus. And so it's really important to take this seriously, to think about your family and your friends and what happens if this gets spread. You need to play your role. We really need you to play your role in keeping the community safe, keeping yourself safe, keeping the people that you care about safe. All of us together can make a difference. All of us together can beat down this disease, but we're not going to do this if we're not all on the same boat and all rowing in the same direction. So I want to encourage everybody, please pay attention. Please do not go out and socialize. Don't think it's okay to go to a crowded bar or to a crowded movie theater, frankly, because everybody's got the day off. All you do is undermine the social or physical distancing that we're encouraging people to take. So please pay attention to what we're saying. Listen to what Dr. Gales has to say. Get your briefs from us. We've got a county website that's going to be, updated as whenever we need to, and pay attention for incoming announcements as this situation continues to evolve.
Consistent with our efforts to make sure that we're getting information out to the residents of our county in an expeditious manner and comprehensive manner, we wanted to give you some updates on our case counts. Many of you who may be following the state page have seen an increase in cases overnight and an increase in cases in the jurisdiction. Currently, as we stand, there are 31 cases that are confirmed in the state of Maryland. 12 of those cases are in Montgomery County. Last night, we received confirmation of 6 new cases, and I do want to comment briefly on the demographics. 4 of those patients are male patients as young as in their 20s and upward as in their 70s, and 2 female patients, 1 in her 20s and 1 in her 30s. I want to do some level setting as we move forward in terms of how we report the data. We will be putting out an aggregate count of cases on a daily basis and not commenting on the specific demographics of each of the cases unless there is a significant exposure or connection to a major entity or other type of contact. For example, one of the cases that we were notified about overnight or yesterday was an employee at NIH. NIH released a press release today to talk to their employees and share with the community about potential exposure. They have conducted or begun a contact investigation to determine which of their staff needed to be quarantined and are taking the necessary steps to mitigate any further contact transmission. I also want to be clear that in any instance where there is a contact issue for the community, we will do our level best to make sure that information is communicated as quickly as we can, but making sure that it is vetted, it is evidence-based, and comprehensive in its nature. I want to take this opportunity to also level set in terms of how things are being reported. Up until last week, the only mechanisms in terms of testing were being done at the state and the CDC level. Over the course of the last week, 2 private labs, Quest and LabCorp in particular, created the capacity to be able to test with their labs. So that means that independent practitioners within the community and health systems and hospitals are able to send labs to those places. What's different about that is, historically, up until last week, all of the tests were screened through the state and the CDC, meaning that up until last week, if an individual was deemed to be suspicious or warranting further follow-up, we talked to the state talked to CDC, and they had to be deemed eligible for the testing criteria. For those at home, you may know by now that that testing criteria has been tied to travel history. Because of that, it is true that we've not been able to get a true denominator of what the potential impact and burden of cases are in our community that aren't tied to travel history and may be suggestive of community transmission. By being able to expand to the private labs, practitioners can order those tests on their own without having to get approval through the state or CDC. We recognize that with this increased testing capacity, we're likely to see more cases, as evidenced by our overnight increase in the local jurisdiction as well as the state level. And because of that, as I repeat, we're going to be reporting numbers in aggregate level because we could see a significant increase on a daily basis. And we'll make sure to report relevant information connected to those cases. For those of you at home who have concerns about testing, we did send out a notice today through our paperless airplane process that talked about testing and who we need it for. Even though we have private lab opportunities now to send additional tests, we know that there are still constraints in the system. So tests are important to be used for individuals who are symptomatic and have concerning clinical pictures, particularly those where it cannot be explained by other diagnoses such as the flu, allergies, etc. We received reports over the weekend that in some spaces there have been physical altercations and lots of upset feelings expressed, where in some cases law enforcement had to be called in to defuse the situation. We don't want that to happen, and we want to emphasize that we are working very hard to create alternative spaces where we can offer other testing opportunities for individuals who need them. We are not at a time where we are offering general testing for anyone who wants to know their status without symptoms concerning for a clinical picture. So that's where we are in terms of our new cases. That's where we are in terms of level setting, where we are in terms of what we will release and discuss, and also wanted to make sure people understood where we are in terms of testing capacity and availability. One last thing I want to comment on to make sure that people understand and to emphasize what County Executive Elrich talked about. Social distancing is important. Social distancing is important. Social distancing is important. I cannot emphasize that enough. It's important to be smart and thoughtful in terms of your interactions with other individuals, because even if you are feeling well or asymptomatic, you could potentially come into contact with someone who is vulnerable based upon their age or their underlying health condition. And so it's important to limit your exposure, continue to follow solid hand hygiene and cleaning surfaces. If you are symptomatic, regardless of the cause, limiting your exposure to other individuals. This is a practice that is important and a practice that we think will hopefully arrest a significant increase in cases over the next days and the next weeks.
We've got nearly 10,000 employees, and we're focused on protecting the health and safety of every employee while trying to deliver some continuity of services to the extent that it's possible. And so these are the things that we're going to be doing. We're going to operate during the period from March 16th to the 27th and potentially beyond that in a modified way. As was announced last week, libraries, recreation centers, and senior centers will be closed to the public. Other services are being modified to minimize interactions between the public and employees. For example, ride-on passengers will be able to board buses only from the rear door unless they need assistance, and all fares are being waived. We're encouraging customers to make payments and submit documents online wherever possible, and we're working to expand our online services. A list of service modifications are going to be available on Monday on our coronavirus website at montgomerycountymd.gov/coronavirus. I've ordered county employees to telework if they can perform their jobs remotely, and we're looking at expanding our capability. We are looking to engage all our employees to assist in service delivery and help with response activities. We will have school nurses testing residents for coronavirus and staffing our health information line. Librarians will be involved in communicating to hard-to-reach populations, and this is not business as usual. Let's see anything else in here. The Department of General Services is performing enhanced cleaning in all county buildings, and employees have been informed of precautions to prevent the spread of coronavirus. We've tried to consider all the challenges that this situation may cause for our employees and their families. Our directors, managers, and supervisors have given latitude to accommodate employees who are part of a vulnerable population or parents of school-aged children and caregivers. And we'll continue to keep you updated.